problem. My name's McCrorie. I work at the University of Glasgow for the Places programme, and my passion is all about how the built, the natural and social environment influences health and well-being of children and young people, particularly inequalities in health and well-being. So I don't know if you can hear just now, but certainly when I was growing up, I would love to go into kind of woodlands, into nature, into parks, because you could hear the birds chirping, you could hear the river flowing, you could hear the animals rustling in the bushes. And there's been a lot of research looking into how that alleviates issues with regards to stress and tension, and also some conditions with regards to anxiety and depression. And I think part of the research we want to do within the university is see how does that relate to children and young people. So Space is one of the projects that I lead here at the university, and it's about a large project where we work with 10, 11-year-olds across the whole of Scotland. We ask them to wear activity monitors and GPS devices for 7 consecutive days. Now these children come from a bigger study called Grown Up in Scotland, and they've been collecting data since they were born in 2004. We asked them to wear these devices in 2015 and 2016, and we attached that type of information to things like mental health outcomes. So a lot of the issue with regards to the evidence right now with children's access to nature and their mental health is about quality of that evidence. And we can do much more with Spaces because of the type of data we have. So we have GPS data, so we know where children go. So we get a better measure of exposure. And because we link this to Grown Up in Scotland, which we have better mental health outcomes, we can combine those two. And it makes a really, really high quality bit of evidence for the literature. So the one measure we've been using thus far with Spaces is called Strength and Difficulties Questionnaire. It's a well-validated measure used in children and young people and has been used for a long, long time. It measures things like social, emotional, behavioural outcomes, things like hyperactivity and attention, emotional problems, conduct disorder, other things like peer relationships and pro-social behaviours as well. Now, Spaces is very unique in the sense that we understand where children and young people stay, so we can extract the amount of nature that children and young people have within their neighbourhood, say something like 100 metres from home, and we can relate that and link that to the SDQ outcomes. So when we looked at that relationship, we found that as nature increases within 100 metres of home of children's neighbourhoods, emotional problems decrease. And we also found that same relationship with pro-social behaviours, but instead of decreasing, pro-social behaviours increased. So it went in the direction we expected and wanted it to see. The really interesting thing about pro-social behaviours, that relationship was more marked and pronounced for children from less affluent backgrounds, what kind of demonstrates that potentially nature could be used as some form of lever to reduce inequalities in health. So one of the things stakeholders were really asking us was, well, there's a relationship between nature and SDQ outcomes, but do children actually spend time in nature? And is that got a relationship with SDQ outcomes? So that's what we're going to do next with the GPS data. The great thing about the Spaces project is that it's also longitudinal. So we've got that information over time, so we can see actually how things change over time as well. The other thing stakeholders are really looking for us to explore are issues with regards to gender, socioeconomic status, and looking at children with neurodevelopmental disabilities as well. Well, I think fundamentally 3 points. 1, we have to raise awareness of the benefits of nature and mental health. 2, I think we actually need to try and do better at advocating for change with regards to policy and planning, trying to ensure that urban environments or rural environments actually afford as much nature as possible for those who want it and need it, regardless of who you are and where you come from. And I think the third thing actually be quite useful with children and young people is to think, certainly where the evidence supports it, to use it as treatment options within our healthcare system as well, and ensure that actually going into nature and using nature has these great benefits for mental health. So let's use it more.